Did you know that 40% of pregnant females and 52% of postpartum females suffer from constipation? What comes up for you when you ask questions about constipation? In today's episode, I talk with occupational therapist Laura Rowan about constipation, what it is, and how practitioners should be asking clients about their bowel health.
Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started.
Hello, everybody. Welcome to this episode. Today, we are so blessed to have with us Laura Rowan. Lauren is an occupational therapist. She is a pelvic health occupational therapist. She works with all gender diversity. She has a clinical practice in upstate New York. She's also an educator, a mentor, and an advocate. Welcome to the podcast, Laura. Thanks so much for being here.
Oh, thanks for having me and taking the time and energy to be providing this support.
Thank you. So today we're going to be talking about constipation.
Yay!
Okay. So I have to say, I do ask the question. I ask the question of, like I have 4 questions that I always ask all my clients and, bladder, sex, menstrual cycle, and then their bowel habits. But I have to say, I usually don't dive further into like what the answers are. So tell us, why should we be asking our clients about constipation or their bowel habits in general?
Yes, thank you. I love that. It just validates why we're talking about this.
Yes.
Yeah, and I did a little market research with my birth working brain trust and asked those questions. I said,
Yeah.
are you asking about it? Answer was no. Do you feel comfortable talking about it if they bring it up? Not really. What are you saying when they do disclose that they have constipation? And water, fiber, take a walk,
Yeah.
all good things, right? But
I have to say, because someone, being vulnerable here, I've been on more the constipation side in my life. And I've just seen that there's so many different factors that play into bowel health that, I think that's why I kind of shy away from it and not really. I also have to admit that I live in a very health conscious community here in Boulder, Colorado. And so I feel like my clients know a lot more than I do. So I want to change this though. So how can you help me? Let's first understand why we should be going there.
yeah, so bowel health, I find, is really this underlying common thread amongst many of our pelvic rehab conditions and symptoms. Right. So we don't typically get the bowel education right away, which I think is for a good reason. There has to be layers and an unfolding of information. And we have to be able to apply the foundational concepts first and experience in them and then be ready for it for the next level. But really, I mean, bowel health could really help our kind of more common bladder incontinence, our painful sex clients, right? So being able to consider, especially constipation, as a potential common cause or underlying impairment amongst all of those, low back pain, lots of different conditions, and also a contributor to lots of different system breakdowns, right? If we have constipation, we are reabsorbing things that we're supposed to be getting rid of, right? Old hormones, just toxic waste, things that we don't want back in our bloodstream, that can then start to break down our other systems. So really starting to change the perspective of, rather than checking the box, yes, they're constipated.
I did ask it.
And yes, that is the first. That's the first. And I
Yeah.
think the confidence of knowing what to do once you have that answer will get people asking the question more, right? I think it's because they don't know what to do with that information. So
Why go there? Okay, so
um,
how do we help someone get more comfortable asking the question?
yeah, so I think, one, we're going to talk about at the summit is to start to better understand all the potential contributing factors that could be at hand, right? Being able to know what could be causing it, so then you can ask the questions and like ask those like deeper questions, like, okay, you're constipated. Let's, describe what your stool looks like, because what one person's idea of constipation may be very different from what you're thinking. So, and also if they say no, I'm not constipated, still asking the specific questions, because a lot of times they are, but they don't associate it with constipation.
Okay, so let's stop right there and let's define constipation then.
Yeah. So you can it's a loose definition, right? And it is
No pun
different.
intended there,
Yeah,
right?
yes. Yes, and but it's also very different for many people as far as like how many times or how often you go. So that's where I think people get hung up. It's like, oh, well, I go every day, so I'm not constipated. However, really looking at that Bristol stool scale, so being able to say, that mid-level stool type 4 is soft, smooth, and solid. And, they'll be like, okay, yeah, it's solid. And I'll be like, any cracks and bumps? Does it sometimes look like pellets? Like that's really getting to a more dehydrated type of stool indicating constipation. And then, so that the stool consistency can be a good indicator. And then effort, right? So are you straining to have a bowel movement? And then not leaving it at that, because straining is very subjective. What does that mean? So
Yeah.
do you have to put in more effort, or does it come out easily? Trying to get a good sense of if there's a lot of effort or not. Um, and then also looking at how often, and especially with the pregnancy and postpartum population, starting to ask or consider questions of, does this look different from your typical, right? So if they're, whatever they're describing, is that how it was before? Is this different? So you can start to really kind of get a sense of what their body is shifting in and out of.
And so, there's a couple of things that could be going on during pregnancy, and I know we're going to dive more into this in the summit, your summit interview. Um, but is it both the hormones that could change the stool, or could it be, and or maybe is it
Yes.
supplementations that they're taking if they do start to take more iron?
Hmm.
Because we do know that iron is more constipating to the system.
For sure. It's
Yeah,
really hard to find a prenatal that does not have iron.
yeah,
And a lot of times you need that iron. So being able to
yeah.
balance those. Yeah, so there's, yes, exactly right. We're gonna really dive into that in the summit to figure out what the contributing factors are, because there are more physiological, right? More mechanical. Like there's structural changes going on in the musculoskeletal system and throughout. There's also hormone shifts. So we know hormones affect our bowels. So we can expect change, right? Um, Hydration levels, right? Our body's prioritizing that baby when we're pregnant. It's going to send all that extra water to the baby. When we're postpartum, if we're breastfeeding, it's still prioritizing that baby for that breast milk.
I have to say, I live in Denver, Colorado area, and it is so flippin' dry here. Dry, dry, dry. I cannot drink enough water every day. I cannot imagine trying to breastfeed here. Luckily, I had my babies in Seattle where it was more moist. But even then, like with breastfeeding, there's so much, you just are so thirsty all the time. I can't even imagine what
Busy,
it's
you're
like.
busy drinking.
Yes,
Drinking and feeding.
and feeding, and it never fails, right? You sit down to breastfeed and you're like, shoot, I forgot my water bottle. Where is it? So, okay. So let's talk a little bit about the incidence of, like how common is constipation in people in general? Do you have that number versus like pregnancy, postpartum?
Yes. Yeah, and actually, so I have a study from Finland looked into the prevalence of constipation in pregnancy and postpartum. And so there's this study showed 40% of pregnant women are constipated, 52% of postpartum women are constipated. And the control group, which I thought was very interesting, of the non-pregnancy group, 21% were constipated. That's a lot.
So, I mean, especially postpartum, every one of two people that come into your office are going to have constipation and, 40% for pregnancy as well. So that is a lot, a lot, a lot.
And just women in general, right? Women in general are more prone to being constipated.
Why do you feel that is?
Well, there's a lot to unpack there, which we will actually get into because we're going to look at the psychosomatic, the mind-body contributions to bowel health, right?
Yes.
And so when you think of a mother's role or a female role, and when we get into holding and releasing rhythms, where we may need to feel a lot of sense of holding
Yeah.
in order to, because the holding is considered a giving, right? A giving phase. So in order to give and do, right? Um, that's one consideration. I believe the female colon is longer than the male colon.
I had not heard that.
We've got more absorption, right?
Yes.
Um,
I was
and
curious if it might be hormonal. Like we tend to run different hormones than men. So
absolutely, we have more rhythms and changes and shifts and things that could disrupt them as well.
right, right. Okay, cool. So how do we really want to talk about helping someone become more comfortable asking the questions. How
Okay.
do we help someone be okay? You practitioners listening in, you know who I'm talking to. You, the one that avoids asking these questions, what can we do to help them?
Well, I think one really easy thing is to have it on your intake form.
Yeah,
So it's being asked already and you get the information. So you already have a sense, but still don't stop there because again, you can get much more and or different information from your interview and your questioning.
yeah. What are the appropriate questions to have on that intake form around constipation or just bowel health in general?
I like to put the Bristol stool scale right on there.
And
Um,
actual pictures of what they look like?
Yes.
Yes.
So they can just circle it.
Yep.
And then underneath it'll give a little bit of a text box for them to be able to say how many times a day. They can put in whatever information comes to mind. And then when we talk about it, I can get a little bit more specific about effort and things like that.
Okay, because that I was gonna say that efforting is a huge component of it as well, right?
Yes. Yep.
And, and I do when I have someone who comes in, especially postpartum, they're talking about prolapse.
Yes.
I do get more curious with their bowel health and their habits with thinking of rectoseals, right? Because those women do have the urge to go, they just can't initiate it or get it to come out if it's prolapsing in front of the opening.
Right.
Um, so I do ask more about that, but I think I stop with, like, oh, you constipate. I need to get that Bristol stools on my intake forms and really dive deeper into that because I'm really excited to talk to you more during the summit to see about that holding and releasing so that I'll have more awareness and understanding of what to actually do about it when I do ask these questions. I think that's a big piece
Hmm.
of why people just aren't going there is because
Yeah.
what are they supposed to do with that information then?
Yeah. And um being able to, so just consider if we were to catch constipation before prolapse, we could be preventing a lot of these unnecessary conditions, right? So being able to like start asking, start the conversation, keep asking, make it part of your routine when you are interacting in pregnancy. If we can catch them even before pregnancy, even better, because we've got young women. I know I, as a female athlete, I would often experience constipation. So just being able to understand how to get out of it or prevent it. But also, let's be realistic, constipation happens no matter what your efforts are sometimes. And being able to have strategies to manage that safely without just having to strain and just try to get through it however you can figure out, right?
Yes, 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 yes. So awesome. Okay, I can't wait to hear more in that summit interview, everybody. Please make sure that you tune in and listen to Laura's talk on constipation there. And you're going to be talking about the holding considerations and the releasing interventions that we can do to help facilitate or to help support our clients in better bowel health. So
Yes, and really looking at the mind body. So really getting into the psychology of things, because there is no body without the mind, and we need to consider why are these. I mean, sometimes it's, the baby has rearranged things. Okay, we get that. But there is often an emotional component, especially going into pregnancy. We are starting to get fearful, to worry. There's intergenerational trauma, and people are starting to be aware of this, and they want to break the cycle. There's lots that we're gonna unpack with
oh,
that.
that's fine. I love, like, my heart just sings when I hear you talk like that. I think that's why I'm so connected to you guys as OTs, because
Yeah.
that's where my brain goes too, like all the time, regularly. And I think it's just so critical and so important for us to be able to go there and to really take in all aspects of it. So yay. Any last little tidbit that you want to share before we say goodbye and everybody can learn
Um,
more on the Birth Healing Summit, your interview there?
yeah, I think, start the conversation, just start to identify, and then starting to consider treating the constipation as a primary, like a key indicator that can really help.
I would say, even before that, Lara, is to encourage everybody to really ask the question, why are you uncomfortable asking the questions? Or, as
Sure.
I like to say better, what is asking the questions about for you? What comes up for you when you think about asking these questions? So you will have some time to ponder those before you hear Lara's interview in the summit in April. And hopefully you'll have some insights for yourself to explore, to be able to maybe hopefully get beyond those issues, whatever thoughts, feelings, beliefs that you have around dealing with bowel health. So thank
Beautiful.
Thank you, Lara. So appreciate it. And thank you, everybody, for listening in to this episode. I hope that you can get curious with yourself and see how you can start asking more about bowel health in your intake with your clients and see what you find. And then we'll see you on the summit and you can learn more there. All right. Thanks, Lara, for being here. Thanks, everybody, for listening in. And we will see you all on the next episode. Here's to smoother births and faster recoveries. Take care, everybody. Bye-bye.
Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.